Hi, I'm Dr. Scott Luper. I'm Medical Director of White Spruce Medical here in Fairbanks, Alaska. And I am delighted that our patients are doing so well. Several of them have got COVID. They've come through it without a hitch. It's been really easy. They're doing what we're telling them to do, and it's working. This is delightful. But there's a looming solution. It's going to be a while for it to come, and that's vaccine. So how a vaccine works is a vaccine takes whatever the organism that we're trying to get an immunity to, and it changes it, it alters it, it breaks it up into smaller pieces, or it kills it, or does something in a way to make it safe, and yet the proteins on the outside are intact. So these are presented to our immune system. Our immune system recognizes them as foreign material, creates antibodies to these substances, these proteins usually is what they are, and then when the real deal comes into our system and we get exposed to it, our immune system is ready. It recognizes these proteins. The proteins interact with our antibodies. The antibodies attract white blood cells. The white blood cells do the killing. Now, it's an oversimplification, but that's the gist of it. The antibodies act like little flags and saying, here is where the action is. White blood cells are attracted. They come in, they dump their chemicals, and kill the thing off. So the vaccine isn't for everybody, because people who don't have functional immune systems, and admittedly these people are rare, but for the vast majority of us, our immune systems do work, they are intact, and there's a lot we can do to get them working better. That's what I want you guys to do. Not sit home and wait for the vaccine to come, but to engage in getting your immune system to be tip-top for two reasons. Number one, the vaccine is going to work better when it comes. Number two, heaven forbid you get COVID before the vaccine comes. We want you to survive. So here's the dealio. We want you to take things and do things that will get your immune system working better. And a lot of this is common sense. Number one is if you get a good night's sleep, your immune system works better. Number two is if you eat well, particularly fruits and vegetables, your immune system works better. If you exercise and the blood flows around, it works better. Now, there's some things you can do that'll enhance your immune system without getting it overreactive. That's what we don't want. We want it to be in the middle, not too low, not too high, somewhere in the middle. So there's a fairly short list of things that you can do that'll help with this. Number one on that list, and the evidence is piling up at how important this is vitamin D. So we want you guys to be taking 10,000 IUs. I know it sounds like a lot. It's not. 10,000 IUs a day. You might even want to take more. What you need to do, let me say it better. You need to get your blood levels above 40, between 40 and 60. You can't do that by feel. You're going to have to go see a doctor. But you have to take enough to get to that level. My suggestion, you should start taking 10,000 and see how high you get. If you get between 40 and 60, bam, you hit the mark. The next thing is to take fish oil. Fish oil is naturally calming to our immune system. Our lungs work better. Our blood is thin slightly. Circulation improves. It turns out to be a fabulous thing. Your skin is good. Your hair's better. You're less likely to be depressed. Turns out to have all kinds of beneficial effects to it. It's not a panacea for every problem there ever was, but it's something that kind of greases the skids and gets everything working better. So, take fish oil. So the third one on the list is mushrooms. Mushrooms have substances that help our immune system work better. So mushrooms are good. You can buy them at the grocery store and eat them. You can take mushroom extract. Here in Fairbanks, we have a mushroom that grows on the birch trees. It's called chaga. It's fabulous. It's a great thing to take. So get mushrooms in your system. Again, it takes the highs and brings them low. It takes the lows and brings them high. Get your immune system working better. Okay, so in summary, we want the vaccine to come through. The vaccine is really going to do more than anything to get our lives back to normal, because it's the way we can get immunity without actually having to go through COVID. So there's that. But it's going to be a while yet. And we want to make sure that the vaccine, once it does come, works well. So you need to be healthy. We want to make sure that you survive until then. You need to be healthy. So what you need to do is everything we talked about on this video. But if I had to pick one thing to really focus on, it's the vitamin D. Take the vitamin D, 10,000 IUs a day. That's my recommendation. So this has been Dr. Scott Luper, Medical Director of White Spruce Medical here in Fairbanks, Alaska. And I want you all to be safe, be healthy, and stay in touch.